In this lecture today, we will try to finish the cardiovascular system pathology. This will be a part 2 of this lecture. In our lecture today, we will talk about the vessel. As we know, the vessel in the body may be classified into 3 types, into artery, into vein, also lymphatic. These types of vessels differ from each other by the anatomical and histological structure. Artery characterized by thickening tunica media with less size tunica adventitia. Meanwhile, the vein have a thick tunica adventitia compared to small tunica media. Both of them have the same tunica intima. The lymphatic vessel structure contained mainly from elastic tissue, fibrin, collagen, like structure of tunica adventitia. May be noticed in the histopathological side or not sometimes. As we learned before, in the first we should talk about the congenital anomaly within artery. The main congenital anomaly called arteriovenous malformation. In this congenital anomaly, the artery meet with vein at a large level or directly. This combined with the traveling of high blood pressure blood into area with low blood pressure. As we know, tunica media of artery can bear the pressure of blood. Meanwhile, the tunica media of vein cannot deal with this, cannot stand with this high blood pressure. That will cause destruction of the wall of vein and hemorrhage occur within vein due to the huge blood pressure within artery. At the normal situation, the artery and the vein meeting in capillary structure. Within capillary structure, the pressure within lumen are equal between vein and artery, and there is no problem at the normal structure. Arteriovenous malformation suffix as AVM. It's commonly in human. In animal, it's recorded within dog. It's dangerous, fatal, depending on the site of which it is located. Within the brain, we can imagine the hemorrhage of the brain, what can lead. The growth disturbance within vessel, within artery, the main type called arterial hypertrophy. Arterial hypertrophy, which is mean an increase in the tunica media. Hypertrophy, an increase in the size of cell of smooth muscle. The size of smooth muscle cell increased. That lead to an increase in the size of tunica media. This increasing in the size usually causes lumen stenosis and may lead to infarction, as we know, to the next organ that connects to this blood vessel. Maybe it's a congenital or also acquired, as we see in atherosclerosis in next slide. The degenerative disease of blood vessel differ from animal to others. It may be hyaline change, and we will take hyaline change and hyaline degeneration within general pathology under section of adaptive change. Maybe fibrinoid necrosis, also amyloid precipitation occur within the blood vessel wall. All this degenerative process, hyaline change, fibrinoid necrosis, amyloidosis, may cause a hardening of the wall, stenosis to the lumen, or occluded of the lumen, and lead to infarction to the organ that connect to this blood vessel. The most important degenerative disease within a blood vessel, which is arteriosclerosis. Arteriosclerosis literally means hardening of blood vessel wall. This hardening of a blood vessel wall causes loss of blood elasticity and increase hypertension with the blood lumen. Arteriosclerosis classify to the three types: atherosclerosis, arteriolosclerosis, and medial calcification. The first one, atherosclerosis. Atherosclerosis commonly affect human and cause major problem, so it's called mother of disease in a human. Atherosclerosis characterized by deposition of lipid beneath tunica intima, above tunica media. This precipitation of lipid may be due to inundation of adipocyte or monoclonal proliferation of foam cell, also due to injury to the endothelia. The damage of endothelia will initiate an inflammatory cell to migrate from the lumen to the subendothelia. This migrated cell will secrete cytokine to the smooth muscle and initiate the smooth muscle to migrate to the subendothelia and proliferation of this smooth muscle within fat tissue accumulation. The macrophage within this this site will transform to foam cell after it's ingest the lipid. When monocyte travel to the tunica intima, beneath tunica intima, it will convert to macrophage. This macrophage, when it deposit lipid, it will be transformed to the foam cell. This foam cell may be die and release its lipid. This lipid may be oxidized and become cholesterol. Cleft, as we will see in the histology. The accumulation of lipid within tunica intima will lead to occluded of lumen of blood and cause infarction to organ. The occlusion of a blood vessel to become significantly should reach to 90% of no lumen closed until there is a clinical signs of occlusion. Let's move to the second type of arteriosclerosis, the second type called medial calcification. The medial calcification occur within a human and called also dog, also horse, called Monckeberg calcification. Monckeberg calcification characterized by the precipitation of calcium deposition within tunica media, and usually it is unknown the cause, but it's related to age. After 15 years, after 16 years, sixth decade, the calcification will begin with tunica media and blood vessel of aged people, usually heart failure people. The third type, which is called arteriolosclerosis. Arteriolosclerosis characterized by fibrin degeneration, as we see in fibrinoid degeneration. Fibrinoid degeneration within kidney, within a small blood vessel, this is called arteriolosclerosis. Arteriolosclerosis. Other important degenerative disease within artery, something called aneurysm. Aneurysm means dilation of artery wall due to weakening of artery wall. Aneurysm, as we see in this picture, as dilated sac protruded from the main artery. Usually it's occur within aorta, in the thoracic region, also as we see in this picture, in the abdominal region between renal artery and iliac artery. This site is common site of aneurysm. The dangers of this lesion occur due to it may be rupture and cause bleeding to the abdominal space and cause severe peritonitis, and it's fatal. Let's move now to the second slide. We will talk in this slide about the inflammation of the vessel. The inflammation of vessel generally called vasculitis. Vasculitis, this term used to describe inflammation of vessel as general, but when we will talk about artery, would called arthritis, then phlebitis, lymphatic lymphanginitis. Usually inflammation of vascular system, usually the vasculitis or arthritis, it is usually systemic due to systemic infection by bacterial, by viral. Also, it's common in equine. In equine, there is some disease called equine viral arthritis, also equine parasitic arthritis. We will see here arthritis due to viral, arthritis due to parasite. Equine parasitic arthritis due to Citronellus vulgaris migration. When this parasite becomes mature, it will be migrate through a blood vessel to reach the intestine lumen. During this migration, it will cause irritant to blood vessel wall and cause arthritis, usually within mesenteric artery. Also within canine, we have a parasitic called heartworm Dirophilariasis within heart of dog and cat also, usually in right side of heart. This parasite causes also arthritis. Coronavirus with feline infectious peritonitis cause massive mesenteric arthritis. We will now talk about the vein. We will start also with congenital anomalies maybe happen with vein. The most important congenital anomalies is called Portocaval Shunts. Portocaval Shunt. Porto from portal vein, caval from the aorta, from vena cava. Vena cava. Shunt like fistula. Shunt mean blood transfer from part to part. Portocaval shunt. Portal vein of liver. Portal vein of liver connects with vena cava. Bypass blood vessel. This called extrahepatic shunt. There is also intrahepatic shunt occur between vein and artery within liver. This is called intrinsic shunt. Intrinsic shunt. While the connection between portal artery and vena cava, this called extrinsic shunt. This is a congenital anomaly, important in dog, usually cause severe hemorrhage within abdomen and death. Degenerative process look like aneurysm within artery. It's dilation also due to weakness of the wall of vein, also due to the valve defect, vein valve defect. As we know, the vein usually have the valve. This valve prevent blood to return to opposite side. When this valve are sustained or damaged, the blood will be accumulate at the lower side, usually within the leg. This is called varicose or varicosity. This is usually called varicose. Dilation of vein, accumulation of blood with this dilation. The complication of this dilation of blood accumulation, it's a thrombus formation and thrombophlebitis, as we know, or venous thrombus, a dangerous thromboemboli will be formed and may be travel to brain, cause stroke, heart traveling, lead to myocardial infarction. The dilation of vein within some part of the body organ, like dilation of vein within liver, called ectasis, telangiectasis. It's usually occur within telangiectasis within vein of the liver. The inflammation of vein, as we say before, it's called phlebitis. Phlebitis usually systemic, maybe autoimmune disease, systemic lupus erythematosus in the dog, UTI infection. All this may cause inflammation of the blood vessel, may occluded it or damage its wall, lead to local hemorrhage. Let's move now to the neoplasia that affect cardiovascular system. First type of neoplasia, which is a benign neoplasia, and we talk about it in the general pathology and the chapter of neoplasia. This neoplastic lesion called hemangioma. The suffix indicate to the benign tumor of endothelial cell. Hemangiosarcoma refer to a malignant tumor that affects the blood vessel and lead to proliferation of blood vessel continuously. It is not rare in animals, it occurs in cows and dog also. Hemangiosarcoma also affect a wide area of horse and characterized by necrotic foci and also occur within other animals in the farm. We will now move to the hemangiopericytoma. There is a pericyte cell within wall of blood vessel. It is non-differentiated cell, act as stem cell. When there is a damage to the blood vessel, the pericyte will be differentiated to become endothelia and replace damaged endothelial cell. In some situation, this cell become crazy and become tumor and proliferate with unlimited number. It's called hemangiopericytoma. Let's ignore this slide and go to lymphatic vessel. Lymphatic vessel also suffer from congenital anomalies, and there's a hereditary lymphoedema. Which is in human called familial miliary disease within a human. Also, it's common within animal, with large animal. It's characterized by chronic edema with some part of body, maybe in the forearm or leg. This edema accumulation occur congenital anomalies due to hereditary lymphoedema. Also, lymphoedema can occur secondary or acquired due to obstruction of lymphatic vessel by parasite like filaria, by pressure, by tumor cell migration. Any obstructive agent to lymphatic vessel will cause obstruction of this lymphatic vessel and formation of the edema. Lymphanginitis, as we discussed before, lymphanginitis means inflammation of lymphatic vessel. Lymphanginitis characterized by erythema of the site of lymphatic vessel. The inflammation of lymphatic node called lymphadenitis as an inflammation of tonsillitis. This tonsil inflammation is lymph node, so it's lymphadenitis. Lymphadenitis to lymphatic vessel only, lymphadenitis to lymph node. Neoplasia of lymphatic tissue, as we talk about lymphoma within a chapter of neoplasia, and lymphosarcoma for malignant type, as we see in this picture. This is a lymphosarcoma, proliferation of lymphatic vessel. We know in the neoplasia of lymphatic, we will not talk about the lymphocyte. We will not talk about the macrophage within the blood vessel. We will talk about the blood vessel, the structure of blood vessel. It's called lymphosarcoma. The metastatic tumor to lymph vessel and lymph node, it's usually occur and it's usually recorded with all animal types. The dilation and rupture of lymphatic vessel due to tumor or due to an inflammation, it's also recorded, and the dilation with the lymphatic vessel called lymphangioectasis. Lymphangioectasis Like telangiectasis within vein, there is a lymphangiectasis. Obstruction of lymphatic vessel lead to dilation of lymphatic due to accumulation of the inflammatory process. This lead to rupture of this vessel to the region which is have been like rupture of the thoracic duct, and as we know it's called chylocele. Chylocele. At this point the lecture ends, and I would thanks to listening.